Ambulatory occupancy have a lot of rules and regulations on it. It's the second highest in number of regulations for general requirements, building services, and operational features. There's a lot of them, rules and regulations out there. And just to give you an idea of the quantification, in the Life Safety Code, there's 12 pages of rules on ambulatory care, whereas healthcare only has 21 pages, so 9 additional pages in healthcare. Part of the reason for this is that healthcare has got a lot of people that are sleeping there. Let's take a look at what makes up an ambulatory care occupancy. Well, similar to healthcare, the people in it are incapable of self-preservation, and a good working definition of that is that when people hear a fire alarm bell, do they have the putzma to be capable of understanding what that bell, that gong, or whatever is saying, and know how to evacuate or know what to do in response to that alarm? And if they're incapable of that, then it's considered incapable of self-preservation. The other thing that's particular about an ambulatory care is that there is no overnight sleeping, as opposed to healthcare where there is overnight sleeping. So that's the major criteria determining between the two of them. I do need to make sure that you're aware of a very important point, is that CMS, they tend to use healthcare definition of a mixed occupancy as part of their working definition for ambulatory care. They basically say, well, you cannot have any inpatients receiving treatment in ambulatory care. That doesn't say that in the ambulatory care occupancy, but it is intuitive in the healthcare occupancy, and they stick very hard to this whole concept of no customary access by inpatients. They basically say if an inpatient walks into any building, that building has to be healthcare. That's the CMS point of view on the whole shooting match. Now, CMS also takes a look at this whole subject of ambulatory care because in Chapter 18 and 19 on 122, they do talk about ambulatory care facilities. Those are clinics and so forth that are intended to provide outpatient service. Okay, well, that's fine. That's what an ambulatory care occupancy is. And if they are separated by 2 hours, and if they're not intended, and here's the key word, they're not intended to provide services simultaneously for 4 or more patients who are litter-borne. That's what the code says. CMS says, we don't care what the code says. You see that 4? That 4 under the federal statutes for Social Security Act says all it takes is one inpatient who is incapable of self-preservation to make it into a hospital, to make it into a healthcare occupancy. And so they don't care if they're litter-borne or not. They don't care 4, 1, 2. They don't want to get caught up with numbers. One person is all it takes, and they have to be healthcare. That's a whole lot different from what the Life Safety Code is. And keep in mind, CMS is an AHJ, and they make up the rules. They've adopted the Life Safety Code, but they don't have to adopt the whole thing. They can adopt it and make changes and revisions and say, here's what you have to follow. That you have to follow their rules if you accept CMS's money. And this is one of the rules that they have different than what's in the Life Safety Code. Because in these other occupancies, there are many things that are the same requirements as in healthcare. So throughout this presentation, I have a little icon of a bed that I've thrown in there so that you could say, that's the same as healthcare, so you don't have to remember that. Let's get started. Ambulatory care, is just like in healthcare. It's a defend-in-place opportunity for how do you respond to a fire. You have to construct it. You have to minimize that evacuation because it's a defend-in-place means that these are incapable of self-preservation. They may not know how to get out and what to do. And so the construction is such that it's got to be designed so that you can stay in the building. You have to have a detection. You have to have a passive system. You have to have an active system for protecting the people, and you have to have training of staff and people. That's a defining characteristics of a defend-in-place kind of an occupancy. And the reason being for that is that ambulatory care used to be a subpart of healthcare occupancies on it.